Hey everyone, welcome back to the Outcomes Rocket. So excited that you joined us again for another exciting episode with some of healthcare's biggest and most innovative thinkers. Today I have the privilege of hosting an amazing person and leader in the space. Her name is Carol Flagg. She's a managing partner of Answers Media Company with over 30 years of experience in the publishing industry. She leads the company's sales and marketing initiatives, including new business development, sponsorship sales, social media outreach, and email initiatives. She's also the producer and host of What's My Tagline? It airs on the Healthcare Now radio, and it's just an incredible show. I had a chance to be on it a month ago, and I recommend it to all that are listening and watching us today. So, Carol, with that intro, I want to welcome you.
Oh, thanks for having me on your show. I'm looking forward to it.
Looking forward to it as well. And you're calling in from Phoenix, Arizona.
Phoenix, Arizona, where it is definitely dry and not underwater like parts of Florida, just hopefully winding down a very long hot summer. So, yeah.
Getting into the good season over there.
Yes. Yeah. A little late this year, but hopefully we'll be below 100 starting this weekend. So, yeah.
Fingers crossed for
Fingers crossed. I'm hoping it's 99 degrees. Yeah, exactly.
Well, speaking of bringing the heat, you certainly are doing that in the media space and in the publishing space. For all the listeners and viewers that don't know about you, help them understand what got you into healthcare and what got you into entrepreneurship.
Yeah, it's a great question. So I was living in Austin, Texas, in the publishing business and involved in things like South by Southwest and whatnot during, 98 to 2008, in essence, the start of the dot-com boom, a little bit of a bust, and then started to boom again. And I relocated back to Phoenix. My mom had passed away and I wanted to be closer to my dad and family in 2008, which coincided with, of course, what they now call the deep recession. Everybody calls it a depression with the housing crisis, but the deep recession. And my best friend and I, Roberta Mullen, we were in Las Vegas. I think we were the only two people in Las Vegas at the time in the spring of 2009. And the Obama administration had passed AARA, the Recovery Act. And part of that Recovery Act was the HITECH Act, which was an incentive program that went on for many years through CMS, through Medicare reimbursements, to incentivize hospital physicians to adopt EHR technology. My business partner was in the medical field anyway. I had the media side of things. And I thought, what an exciting time for me to probably explore this. I'm not a healthcare person. I've never been a healthcare worker. Don't even have a family member that's worked in healthcare, ironically enough. But I was really intrigued by this idea of this movement for going digital, because obviously that's where the media was going. Obviously print newspaper was dying at that point.
Yeah.
So I thought, well, this idea of taking what media background I had and, the burgeoning digital aspect of media and applying it to what was going on in healthcare was very appealing.
That's great. Well, you had great timing.
Or bad timing, depending on
Yes. I look at it as great timing. You got in at the right moment. Obviously, it was a turning point. Let's call it that.
Yeah, it was. It was definitely a pivotal point, I think, in the healthcare industry.
And so you got in, and when you got in, was it what you're doing today? Was it the Answers Media Company?
Yeah, it started with our first news site, which was HITECH Answers. Again, the HITECH Act is what we were reporting on and providing information out there for hospitals and physicians looking to adopt EHR technology, earn their incentives and whatnot. And that went on from 2010 into 2015 when MACRA passed. Yeah. But you'll recall perhaps the days of HIMSS when you would walk on the exhibit floor 2011, 2012, and every banner said meaningful use on it. It's just it's all they could talk about. I mean, and there were talks, of course, of health information exchanges on a statewide level. It was the infancy of interoperability. That term began to get kicked around. So we rode that HITECH Answers pony for quite a few years. And then when MACRA passed and things really began to wind down on that HITECH side, and we were expanding our coverage anyway into security with the Omnibus Bill of 2013, MACRA passing in this, the RCM space. And just the expansion of health IT in general. And so we eventually morphed into Health IT Answers, which is our news site, part of the Answers Media Network. And then I know we're going to talk about this, I'm sure, in a second. And then we debuted our Healthcare Now radio station in 2012. So that's been cooking along. Oh gosh, 14 years now.
Amazing.
Scary. Yeah.
The time flies, and you guys are creating such great content. I think of you guys as a great source for connecting with the right audiences, to learn about what's out there, the latest and greatest. As you guys started down this road and now, what would you say differentiates you? What makes you guys different or better than other solutions that people might have out there?
Yeah, that's a great question. Definitely from a media standpoint, I think the real differentiator for us is Healthcare Now Radio, which includes a podcast side of the coin as well. Obviously, podcasts, you know this, really began to take off and rise in 2016 with an Apple update and release of the podcast icon on the iPhone. But that's a long story. But I think really the radio side of it, Healthcare Now Radio is first and foremost a streaming radio station that streams 24/7, obviously an internet radio station in the US and even overseas. We have a certain percent of our audience listens worldwide, right? And I believe we still are the only internet radio station in the healthcare B2B space.
Oh, really?
Yeah, I think so.
That's cool.
Again, differentiating radio from podcasts. And
Sure.
I think that is a pretty big differentiator for us, and I think there are people now today that we talk to and reach out to us who actually don't even know our high-tech answers, health IT answers roots, right? They just think, oh, you're Healthcare Now Radio. I listen to you on my car. Or I stream you here, whatnot. Or I listen to, all your podcasts as episodes go on demand on our podcast channel. And so I think that's what differentiates us. And, as time has gone on through, the digital transformation of healthcare and what's gone on in a cybersecurity standpoint and COVID and all those kinds of things, our Healthcare Now Radio, I think, is what allows us to really provide a diversification, I guess, of voices across the industry in a wide range of topics that really go beyond our health IT centricity that you find in Health IT Answers.
I love that. That's a very clear differentiator. And to that point, I also didn't know about the Answers Media Network. I always knew you guys as the Healthcare Now Radio.
Yeah.
So, when we started to get to know each other and you started explaining everything to me, I was like, oh, wow, that's cool. The roots are beautiful and sort of grounded in the history of what's been happening in healthcare.
In the digital side of it, I think for sure. It's the health IT side and the digital movement of healthcare, right?
Yeah. I love it. Okay. So, as you guys have been building the business, the media platform, what's one thing that's sort of risen up as a challenge or a setback that's been a trying one, but that's made you guys so much better as a result?
Well, I think I'm going to get a little personal here for a minute or so. So I didn't have a healthcare background. I've never had any healthcare physical challenges. I've been very fortunate in that regard. And I, for many years, was really excited about what was happening in healthcare. I'd go to these conferences and, HIMSS and Vive and Health and a few others, and looking at the innovation and the technology that was going on, and just was very excited about where the future was going. And then in October of 2022, I lost my younger brother to complications of diabetes. And in May of 2023, I lost my admin person to Ewing sarcoma. And those are obviously two very different diseases, right? But similar cases in that both my brother and Rachel dealt with the extreme frustrations of dealing with the healthcare system. No interoperability, paperwork every time they went to a specialist, the records not being able to move, insurance companies denying procedures and in certain aspects. And the frustrations and the delays that they went through and the lack of back and forth and the lack of communication, I was hoping we were solving in healthcare, really was part of both of their demise. And it was a big moment for me. And I remember thinking, wow, we've been doing all these great stories and voices and conversations for years on our radio station and stuff that we're printing. We're always talking about the latest and greatest in innovation. And yet here I was on a personal standpoint. I lost two people, a family member, and then my admin person who I was very close. Thought of her as a daughter, to these circumstances that make healthcare suck in the US. That's why, healthcare is hard. Healthcare is complicated, right? And that really hit home. And I really began to sort of reach out to various hosts in our network, some who I'm very close to. They've been on our radio station for a long time. And I was like, it's okay to have tough conversations about this. Yes, certainly healthcare today with innovation and tools and applications have saved a lot of patients, but for a lot of people, they don't see the benefit of that. And how do we shed some light on that? I had Rachel's mom on Dr. Nick's radio show a couple of times. I was on a couple of radio shows. And some of these hosts, again, that I'm close to, they continue to explore really the difficult things that I don't experience personally in my healthcare. Maybe you don't, but that so many people in the US are experiencing and frustrated about.
Yeah, it sounds like, and sorry for what happened. And, it just sounds like those events, losing close people to you really kind of open your eyes to a lot of the hardships that people are going through. And it sort of opened up a new outlet for what you guys are covering.
Yeah, I think that it opened up this idea that innovation, we live in a world of innovation, right? Not just healthcare, but, across our entire lives. There's new things coming up. The apps, AI, of course, is changing the world that we live in. And I think what it brought home to me and, obviously to my business partner, who's also my best friend and very close to the situations that I went through, that we can, as a voice out there, talk about these things. We have a radio host now that's spending some time really talking about diabetes, which is an epidemic in the US. And again, my younger brother died of complications from diabetes. And, great that we have these technologies to help manage, but really, what is that person's home life? This kind of gets back to social determinants of health, right? Like, what are their challenges? What is the financial side of what they're dealing with, the personal stuff they're dealing with, their family situation? Are they alone? Do they have a ride? Why is it they just can't call a doctor's office to get an appointment?
Yeah.
It's just these simple things that we think that we should be able to accomplish, but we can't. And I didn't say this, but I heard somebody say this not too long ago in the last year or so, that there's a difference now between how people can be categorized almost in healthcare. There's the consumer and then there's the patient. If I'm the consumer, I'm doing my due diligence, I'm researching, I'm online, I got portals, I'm looking at my lab results, I've been very actively involved, right? And that's just by nature anyway, and, maybe digital savvy. But then there are patients who still, maybe they're a generation older or maybe they're not, but the patients who are just patients, tell me what to do. Can I just talk to somebody? Can I just call today and make an appointment? I don't understand these 20 hurdles I have to go through in order to see a doctor about my condition. And so are you a consumer or are you a patient? And I think that these are the stories that are resonating with me today. And when we have those kinds of stories in our podcast network, for shows that we syndicate or on our radio station, they're the ones that I like to shine a light on.
I love that, Carol. Yeah, it's such a really nuanced idea, but very clear. And what are you guys all thinking about yourselves? Are you a patient or are you a consumer?
Yeah.
I like to think of myself as a consumer. I dig into things and, I guess that's one to unpack for sure.
Yeah.
We could definitely spend more time chatting about that. I want to leave this idea with all of you to think about yourselves, but also this is the world that we live in now. We're all consumers. We have Netflix, we have Starbucks, we have Amazon. So it's time that we start looking at ourselves as consumers of healthcare instead of just passive patients, to Carol's point. So really appreciate that idea that you left us with, Carol. As we sort of think about trends and technology in healthcare that's really game-changing, what's one thing that you would point to that is worth a double look?
Yeah. So, obviously AI, that's like the duh. That's the Homer Simpson moment, duh, right? And I obviously there are a lot of people who are, AI is already changing healthcare, whether it's on the patient-facing side, the consumer-facing side, whether it's with technology, all that kind of stuff. And then there are people who are talking a lot about responsible use and ethical use of AI, where that lands, which I think is actually, to me, a really interesting side of this. It's obvious I use AI in my life every single day. I mean, we all do. Maybe we don't think we are, but we do, right?
We definitely do.
But the ethical and responsible use of AI, I think, is sort of fascinating. And there's lots of conversations going on around that as AI gets more prevalent in healthcare delivery. I think those things have to be tackled. I don't know if they should be tackled. Some of it's trying to be tackled, I think, on the governance side. Obviously, the security side, is imperative. But I think it's just really interesting. The genie was let out of the bottle quite a while ago. And, whether you're one of those like, oh, AI is great, AI is good, or whether you're like, hey, I saw the Terminator 5 times, AI is going to kill us, right? But like everything, the truth is probably someplace in between. And I think that when it comes to that conversation about the use of responsible AI, whether it's on the provider side or as a consumer, i.e. patient, our side, I think that that's an interesting conversation to come. I also do think that, brought on by, just from a government policy standpoint, but brought on by TEFCA and the designation of QHINs and QHIN, you can Google the acronym, this idea of perhaps taking that next step towards interoperability, across the healthcare ecosystem. And my personal opinion, again, through my experiences that I went through, is that without full scale interoperability, we're going to lose more patients than we should. We're going to lose more people than we should.
Yeah, I agree with you completely on that one. And I think we're steps in the right direction. You're leaving us with a lot to think about. Like consumer or patient? How are you ethically deploying AI? Are you thinking about your safety? Guys, this is the right podcast to be listening to today.
Safety first.
That's right. Safety first. No, I love it. Very stimulating, Carol. Always appreciate our conversations and how thoughtful you are about these topics. Look, we're here at the end. I want to give you an opportunity to share where people can listen to your show. How could they get in touch with you? Ways to engage with Answers Media Company.
Yeah. So our Health IT Answers news site is healthitanswers.net, just how it sounds. And then our station website is healthcarenowradio.com. And that's where you can stream our live radio stream and also check out all our podcasts and shows. Also, always looking to connect with people on LinkedIn.
Amazing. Well, folks, there you have it. Carol Flagg, an extraordinary leader in healthcare, managing partner of Answers Media Company, here with us today. She shared a couple ways for you to find her and listen to her show and all of the different podcasts that are on their network. Take a look at that in the show notes. Take advantage of it and reach out to her on LinkedIn if something she said resonated with you. This is how we make things happen. So thank you all for tuning in. And Carol, thanks so much for being with us.
Oh, thanks for having me on. I appreciate it.